Hi folks, it's Dr. Napolitano here giving you your February health update. I've been asked by Jill to talk about the heart health, given February is Heart Health Month. So we'll start with the heart. That makes sense to be for our first month to talk about. So you guys have probably heard a lot about diet, exercise, and screening. So I just want to add my own quick take of some quick tips. For diet, we all probably heard about the Mediterranean diet or the Blue Zone diet. There's some islands off Greece, Italy, or Japan known as the Blue Zone Islands, and they're places where people are known to forget to die, as they say. One is Ikaria. It's an island off Greece, and people regularly live to over 100, and so they wanted to see what are these people doing different. So there's a lot of great cookbooks on the Mediterranean diet and the Blue Zone diet, and I have some myself. And the myth is that they have no taste. That's not true. They're very, very tasty. So one thing I figured I would add in that you guys may have not heard on, and Jill said to add in some facts. One of my favorite clinical trials was called PREDIMED, and it was a study on the Mediterranean diet. So which country do you think the Mediterranean diet study was done in? I ask people this sometimes, and they often get it wrong. It's actually Spain, which also abuts the Western Mediterranean Sea. And another interesting fact, by the year 2040, the longest life expectancy will actually be in Spain. It's definitely not the United States, but we can try and catch up. In PREDIMED, they took about 7,500 people who were known to be at high risk for heart disease, but didn't yet have proven or documented cardiovascular disease. They followed them for about 5 years. They put them on a control diet, their regular diet. They put them on a Mediterranean diet supplemented with extra Mediterranean virgin olive oil, or supplemented with nuts. And they found a significant improvement whether you did the Mediterranean diet supplemented with nuts or olive oil. Both are great for you. They looked at the big ones, stroke, death, MI, and after about 5 years, this happened in about 4.4% of the people who were on the regular diet, and it happened in around only 3.5% of the people who were on the Mediterranean diet, either with nuts or olive oil. Yeah, so that's PREDIMED, and it was a pretty great study, and it showed a relative risk reduction of around 30% by a diet alone. So my patients who are very at risk, I'll often use medications such as statins and aspirin and other medications, but definitely I think that PREDIMED shows that the Mediterranean diet has a role as well on top of medical therapy. Exercise. The American Heart Association recommends 20 minutes of cardio a day. I myself can't find 20 minutes every day, so you're allowed to add it up, and you could do 40 minutes every other day or 60 minutes every 3 days. So that's the recommendation. I tell everyone to find what they like. Some people like swimming, some people like using a bike, treadmill, playing outdoor sports like basketball and tennis. So whatever is your thing, you have to find it and try and get at least 20 minutes on average a day. Screening. Now, this is probably my favorite topic. So you guys are all aware of the colonoscopy and the mammogram. In your 40s is when you start doing these screenings, and they're definitely great. Calcium scoring is the screening of the heart. You could think of it as the colonoscopy or the mammogram of the heart, and yet there's really no pain or troublesome prep for a calcium score. Calcium scores are not covered by insurance. They've been out for over 20 years. There's great data for them. The industrious cardiologists in Texas did fight with the Texas state government. They are covered in Texas, but so far that's the only state that insurance pays for them, and they allow them every 5 to 10 years. So when is the perfect time to get a calcium score? Well, recent studies showed around age 43 and a half. I recommend patients around age 40. Or just like with cancer screening, you might want to do it 10 years before someone had a serious event. So what is a calcium score? It looks for calcified plaque on the heart arteries, which you can detect on a low radiation CAT scan. Up to 10 years before a clinical event. And we don't just do this to create anxiety. And when I started here about 5.5 years ago, I was worried I was going to be creating anxiety. But there's some great data from a study that I've given on grand rounds that show that we can, if we find the right person who's at moderate risk based on the calcium score, by using the correct medical therapy, we can lower the risk of death, stroke, and MI by 68%. So that's really huge. That's not 5%. And it can help find people who are at a very, very low risk, and it can help find people who are at a very high risk. I can say that in our own Haywood community, I find that the scores are very helpful, and that I often get a score of 0, which is perfect, or a score of over 400, which is very high. So I feel like it often reclassifies patients to a lower or higher group that would have been missed had they used the Framingham risk score or the ASCVD risk score alone. So that's it, folks. If you guys want to refer to any of the things I've mentioned, I've put them on my website. It's at craigmd.com, easy to remember. And at the bottom, I have some slides on talks that I've given about these topics. Thanks. Bye.